My name is Dr. Marvia Jones. I'm the director of the Kansas City, Missouri Health Department, and we are so grateful to have the interest. Today, we're so grateful that you are here and engaging with us and helping us really get the community prepared. We're talking about measles today and what that means for our community and what we're doing to prepare. I want to also acknowledge our acting city manager, Ms. Kimiko Gilmore. Thank you for being here. Thank you for your support as well. I'm not going to take a lot of time because, as you can see, we have a lot of speakers, and you probably want to hear from them more so than me. The purpose of today's conference is because we believe in being proactive. We want to make sure that our strategies, our discussions, our partnerships are already warm in advance of any cases in Kansas City, Missouri. You have probably heard about the thousands of cases that are across the country in other states, most notably Texas, New Mexico. We have now had some cases in southwest Kansas, and those are spreading. We also have a case as of 2 weeks ago in Taney County, Missouri, which is the Branson area. So it's clear to us that measles are just a car ride away from Kansas Cityans. And so as people start thinking about travel and vacationing and all of that, and people just being people, which transfers infections across our metro area, we want to be prepared internally. We are already prepared. As you're going to see today, and our preparedness is made up of not just the Kansas City Health Department, not just the city, but it is made up of our partners as well, such as Children's Mercy, University Health, child care facility owners, our full network of people who understand their role in protecting vulnerable Kansas Cityans. I'm going to introduce our first speaker, and then we'll just go from there. The first person who will be speaking is going to be Dr. Lukey with University Health, who is our partner who works closely with our health department vaccination clinic. And she's going to talk to you about who should receive the vaccine and who is at risk and the safety of the vaccine. So thank you very much, Dr. Lukey.
Well, good morning. Thank you for being here today. My name is Dr. Susanne Lüttke. I'm an infectious disease specialist here at University Health Truman Medical Center and the Childhood Immunization Director of the Public Health Office here in Kansas City. We just heard from Dr. Jones that the U.S. is experiencing the largest measles outbreak since 2019. And we have over 800 cases across 29 states, and Missouri just confirmed their first case. Kansas has over 30 cases already. So this is a wake-up call. That's why we're doing this press conference. And I will be addressing those 5 points Dr. Jones already mentioned. I will talk about who should receive the vaccine, do seniors need a booster, effectiveness of the measles vaccine, the safety of the measles vaccine, and discussion of potential complications of the vaccine. So who should receive the vaccine? The measles vaccine is given as part of the MMR vaccine, which protects against measles, mumps, and rubella. Children should receive the vaccine, the first dose at 12 to 15 months of age, and the second dose at 4 to 6 years of age, just before they enter school. The second dose can be given earlier as long as it is at least 28 days after the first vaccine. Teenagers and adults who have never received the vaccine or are unsure of their status should get vaccinated. So if you are unsure, speak to your health provider. It's safe to get another dose. There's no harm in receiving the vaccine again, even if you've already been protected. So do seniors need a booster? If you were born before 1957, you likely had natural exposure. You're considered immune. You typically do not need a booster. Adults who are born in 1957 or later who lack documented immunity should receive at least one dose. High-risk adults may need two. Antibody testing after vaccination is not necessary. The vaccine is considered effective on its own. The third point, effectiveness of the MMR vaccine. So the vaccine is very effective. 93% protection are given after one dose, and we have 97% protection after 2 doses. So before the vaccine was introduced in 1963, we had nearly 4 million people who had measles each year in the US. On average, 48,000 were hospitalized, 1,000 developed brain swelling or encephalitis, and 400 to 500 died each year. Those cases dropped by 99% after introduction of the vaccine, and in 2000, endemic measles was eliminated in the US. So this progress is at risk right now. Measles is spreading incredibly easy. So if you have a room with 10 people and you put one person in this room who has measles, 9 out of those 10 people will get the measles. Granted, those 10 people are not immune against measles, of course. So to stop the transmission, we rely on herd immunity. Herd immunity we have when 95% or more of the population is vaccinated. Then outbreaks are unlikely to spread. However, right now in Missouri, the kindergartners' MMR coverage rate is just over 90%. So that's below the immunity threshold. Coming to the safety of the MMR vaccine, the vaccine has been used regularly since the early 1970s, and over 100 million doses have been administered worldwide. Its safety is backed by decades of data and extensive surveillance. Most side effects are very mild and short-lived. So it includes soreness at the injection sites, low-grade fever, mild rash, and adolescents and adult women sometimes develop joint pain. But this is very temporary. Serious side effects are very rare. Severe allergic reactions happen in fewer than 1 per million doses. So coming to the complications of measles. So measles is not just a rash and a fever. It's a serious disease with real risks. 1 in 5 people with measles in the US is hospitalized. 1 in 20 people or children develop pneumonia, and 1 in 1,000 develop brain swelling, which is also called encephalitis, which can cause seizures, hearing loss, or long-term disability. And 1 to 3 children in 1,000 children who have measles will die even with very good medical care. So to close, protecting your child, your school, and your community, you need to vaccinate your child. The MMR vaccine is safe, effective, and widely available. If you're unsure about your child's vaccination status, please contact your healthcare provider or your local health department today. Prevention is always better than treatment, and now is the time. Thank you.
Thank you. Thank you, Dr. Ruki. And I'm sorry, I'm remiss. I did not announce our panel or introduce all of them, just so you know who's up here. We also have some partners represented who I caught their names before. I wanted to give them a shout out as well. So Cindy Callender, who is with the Kansas City Health Department, is our epidemiologist. We also have Dr. Goldman and Dr. Schuster from Children's Mercy. We have Ms. Camila Junaid, who is the owner of Each One Teach One child care facilities. We also have Ms. Lauren Grimes, who is the lead nurse at Kansas City Public Schools. We also, as you heard from Dr. Lutke, we have Deputy Director of the Kansas City Health Department, Nasser Jahari. We also have Dr. Francisco next to him, who is the Health Department's Chief Science Officer. And then we have Dr. Neen Haluk, who is with Operation Breakthrough, who has joined us today to stand with us. And we want to give a shout out to all of the different child care learning centers that are represented here, who I was able to catch their names. Ms. Megan Huffman with Rising Sun Learning Center. Others in the room, I see other school district folks, I see other partners, and I thank you again for being here. So moving right along on this important topic, we'll hear from Drs. Schuster and Goldman from Children's Mercy.
Hi, thank you. I'm Dr. Goldman. I'm a pediatric infectious disease physician at Children's Mercy. I'm going to briefly talk about the signs and symptoms of measles. So measles initially starts with fever and then the 3 C's. So cough, coryza, which means runny nose, and conjunctivitis, which means red eyes. Sometimes people, when they initially have these symptoms, they can also develop white spots in the mucosa of their mouth, so in the cheeks, in the inside cheeks. About 2 to 4 days after fever starts, the person will develop a rash that starts at the head and then spreads down to the trunk and then the extremities. And then I'm also going to talk briefly about when someone should seek medical care. So the most important thing, as recently mentioned, measles is very, very contagious. So we would like to avoid people showing up in waiting rooms if they suspect they have measles. We want them to call their doctor or call the hospital and say, I have a suspicion of measles, and then the call will be able to be triaged to provide additional guidance. But we should suspect measles anytime a patient has a febrile rash if they're unvaccinated and living in an area where measles is occurring in the community. So again, unvaccinated, measles in the community, and then someone has fever and rash, we should think about measles, or if they have traveled internationally. People should seek medical care. Again, call first, get triage, but people should consider medical care and seek medical care if they are dehydrated, not able to keep fluids down, if they are having respiratory symptoms. As mentioned, measles can cause pneumonias, and so if they're having difficulty breathing, or if they are having changes in their behavior or seizures, they should absolutely seek medical care.
I'm Dr. Schuster. I'm one of the pediatric infectious disease doctors at Children's as well. I'm going to be talking a little bit about how Children's has been preparing. I think probably one of the most important things that we've been doing is communication. So we've been working closely with Dr. Jones and her team at the health department to develop a plan for children in the Kansas City region and our community. So we have been working on developing pathways both within our hospital if a child shows up and measles is suspected to prepare our providers on how to appropriately triage that person and get them tested and work with the health department. We've been communicating with our local pediatricians and other medical providers who take care of children to provide education about what measles looks like. What are the signs and symptoms, as Dr. Goldman mentioned. Many of our providers have never seen measles before, and so we're doing a lot of education about what is the natural course of measles, what does measles look like, what does that rash look like, both with our providers and other community organizations that serve children, so people can be aware. And then we are doing information and communication with patients who are coming into our hospitals about the importance of vaccination. So lots of ongoing discussion around partnerships with our community organizations and our health department. If people are bringing their child to Children's Mercy, either because there is a question of measles or for another reason, we have made a few changes. So everybody who comes into our system, whether it's through our emergency department or for a routine clinic appointment, is being screened for signs and symptoms of measles, as well as travel to or exposure to an area where measles is circulating. So we are trying to identify these cases early. As Dr. Goldman mentioned, measles is highly contagious. And so if somebody who is coming in who has been exposed to measles or who is concerned or has signs or symptoms of measles, we want to identify them early so we can appropriately prevent other people who are in the hospital from being exposed to measles. And so going back, really the importance for parents, if there is a concern about exposure or concern that your child has measles, please call either the hospital or your primary care provider before showing up so that we can figure out a way to safely see your child but limit exposure to other children who may be at risk because they're too young to be vaccinated. Other things that the hospital is working on is we're working on pathways. And so if your child has been exposed to measles, we're working with the health department to coordinate testing and administration of either a medicine if they're too young to be vaccinated, or coordination for vaccination if they're eligible after exposure. And that is everything I think I have.
Thank you. Dr. Francisco?
All right. Hello, everyone. I am Dr. Alex Francisco. I'm the Chief Science Officer for the City of Kansas City, Missouri Health Department. I wanted to begin with a little bit more conversation around herd immunity and what herd immunity really is. So I prefer to refer to herd immunity actually as community immunity. It is quite important as a concept because what it does is protect those who are actually unable to be vaccinated. So if you consider the MMR vaccine, that course of vaccination ends around 12 months. That is the current standard recommendation. That means that anyone under 12 months is not fully vaccinated. There are also individuals who are immunodeficient who are not eligible to receive these vaccines, and the community protection is conferred to them when we reach certain thresholds dependent upon how infectious a disease is. So for measles, as my colleagues have already referenced, that threshold is somewhere around 95%. That is the goal that we're looking for a vaccination level for a community to protect the individuals who are unable to receive that vaccine themselves. Recently, we were able to receive data from the state. So the state actually restricts access to vaccination records to the health departments, unfortunately, that make some of these analyses difficult. They did provide us with some data that demonstrate vaccination rates by zip code for schools in those zip codes. So the following data are specific to the 2024-2025 school year and specific to zip codes, the schools within the zip codes that I'm about to reference. There are 3 zip codes in Kansas City with vaccination rates for MMR that fall below herd immunity thresholds. The first one is 64114, which travels down Ward Parkway into Waldo. And that zip code, the schools within that zip code have a vaccination rate of about 93%. The second one is 64151, which is up north near Lake Waukomis. The vaccination rate for that zip code, for schools within that zip code, is 92%. Both of those really would only require a small push to reach that herd immunity threshold. The final zip code is 64155. That is up north. That is in the area where Staley Farms is located. That zip code, unfortunately, has a vaccination rate of 84%. The religious exemption in that zip code to the MMR vaccine has doubled since 2019. So in 2019, the religious exemption, which essentially is what you would tell your doctor as your reason to not receive that vaccine, was around 7%. It is now about 14%. That is about twice the rate of the second highest religious exemption, which is 64151, which is around 8%. After that, again, religious exemption in 64114 hovers around 7%. After those 3, the religious exemption rate drops to around 3%. So those 3 not only have the highest rates of religious exemption, they also have the highest rates, or the lowest rates of vaccination for MMR specifically. Importantly, the medical exemption rate for all 3 of those zip codes is 0%. So there's no one who is not receiving those vaccinations due to medical exemption. Those are primarily the religious exemptions, and those rates have steadily increased since 2019. Now, I do understand that folks have hesitancy about the MMR vaccine. It is understandable. There is a flood of information that you can find online, accurate or not, that really serves to muddy the waters. When you receive all of that information all at the same time and you are worried about the safety of your child, there is a tendency to panic, and when you panic, the default is typically inaction. So you choose not to do anything in the face of a plethora of information. That is a standard pattern of decision-making, unfortunately, in many scenarios, vaccinations included. But put plainly, there is no link between the MMR vaccine and autism. That has historically been the most recent example of vaccine hesitancy information, and resistance to vaccines is really not a new concept. It dates all the way back to some of the first vaccines like smallpox. However, the origin of a link between MMR and autism started with a man named Andrew Wakefield, a disgraced scientist who proposed this vaccine link between these 2 conditions in order to sell his own vaccine to the same problem. That's not really widely known or shared, but that is really the origin of why that was the case. He held a patent for an alternative vaccine that he decided would be better than the current version, and he had to discredit that current version. After pressed with a lawsuit on that link, he retracted that paper. In this vein, as an understanding individual, I try to be empathetic towards folks who have hesitancy around vaccines. They're not coming from a place typically of hatred. They're coming from a place of concern for their children. That is a very understandable place to be making a decision from. So we do have planned community conversations for individuals with the North Kansas City School District right now to address some of these hesitancy concerns, and we will be forthcoming with those details at that point in time, but I wanted to leave you at least with that information as we move forward with this evolving outbreak.
Thank you. All right, hello, my name is Cindy Callender. I am the epidemiology specialist here at the Health Department. And I'm going to be talking to you today about what it looks like if a case comes into our community and the steps that the Health Department would take. So first, currently we are trying to put out as much information and education as we can to our partners, and that includes our healthcare providers, our schools, and also our daycares. And then really trying to educate the community also on what measles is and what to look out for as far as early signs and symptoms. Suspected cases of measles, that is a reportable condition to the Health Department, and if upon suspicion, it is to be reported to the Health Department within 1 calendar day. So once that gets started, we will go ahead and determine whether or not that case is going to be an actual positive confirmed case. I would like to say at this moment, we do not have any confirmed cases in the KCMO area, but that does not mean that we do not get cases that go to the healthcare providers to get tested to rule out measles. One of the things about isolation, if we did get a case of measles, we are going to let them know that they need to isolate from 4 days from that rash onset. That's when the rash started. If we also will do an investigation with that particular individual so that we can kind of see where they may have been, where they have gone, who they may have exposed. We're trying to get a contact list so that we can go ahead and reach out to those individuals and try to determine whether or not they have documentation of immunity. If they do not have documentation of immunity, they will need to isolate for up to 21 days from that last date of exposure, or quarantine from that 21 days from last date of exposure. We do recommend, if they fall within that time frame of 72 hours, to go ahead and get the MMR vaccine as a post-exposure prophylaxis. If they do get it in that time, they can go ahead and resume back to their normal activities. But if they do not fall within that time frame, then that's when we will go ahead and have them isolate for that 21 days from the last date of exposure. If we do have a case that is identified and they have attended their either daycare or schools during that infectious period, that is, the infectious period is 4 days before the rash starts, and then 4 days after that rash starts. So that's the kind of timeline that we're looking at. If they are, we will notify the daycares, and then we also notify any schools where that student may have been still attending their sessions. That's also going to be a part of contact tracing, so we're going to make sure that we determine who has documentation of vaccine or immunity. And then if they do not, again, they will also need to exclude from others for 21 days from that last date of exposure. So the real goal really is to just push up and recommend vaccines at this time while we do not have a case, so that we can go ahead and prevent anyone from having to exclude. Thank you.
Good morning, everyone. My name is Nasser Johari. I'm the Deputy Director here at the Health Department. As you heard from the group, it's a matter of not if when we get cases here in Kansas City, it's when we get cases here in Kansas City. So as to prepare for the pandemic here in Kansas City, we are currently offering vaccines to the children. It's the vaccines offered here at the Health Department. It's free for the ages of 18 and under. We're changing our operation hours. Our office will be operating. Currently, we operate from 8 to 5 p.m. We will be operating one additional day a week. It's Wednesdays. We'll be operating until 7 o'clock. We will start on May 14th. That will be the first Wednesday that we'll be operating our office from 8 to 7 p.m. And also, we will be on that week, the week of the May 14th, second week of May, we will be operating on Saturdays from 8 to noon, to provide the vaccine and to provide services to our residents. In addition to all this work we do, we believe that we are ready to provide the services for our residents. We currently have 9 staff at the office at the vaccination clinic. We are in the process of adding 3 more to provide the services. If we believe that we need to add more staffing, we are ready. We have the city manager here. She'll be assisting us with adding more staffing. Also, one of the other things that we're doing, we're trying to reach out. We will be reaching out to our partners, childcare providers, school districts, to provide all the educational material. If we believe that we need to do an outreach, be on site, provide the vaccine at your facility, please just reach out, let us know, and we will provide the services at your facility if we need to be out there. That's all I have, and we'll be ready for questions later on. Thank you.
Hello, my name is Lauren Grimes. I'm the Director of Nursing Services at Kansas City Public Schools. We have been working very closely with the health department to make sure our students are immunized, giving them every opportunity to get that done. The health department comes to our schools and gives immunizations to students with parent permission right there at the schools. And we also work with our transportation department to bring students in to the health department. What we don't want are kids missing any more school because they do not have their immunizations. So we work very closely with the health department to get that done. If we have our list of students that are not immunized against MMR, and we've been working with the health department to make sure we keep that list updated so that if there is a case in the schools, we are prepared with our students who are not immunized against MMR. We all strongly encourage all parents to get those immunizations so that they can stay in school and stay healthy.
Good morning, everyone. My name is Camila Junaid, and I'm the owner of Each One Teach One Learning Center, and thank you all for being here. As the owner of 3 child care facilities, I have the privilege and the responsibility of caring for many young children every day. Their health and safety are not just a part of our mission, they are the foundation of everything we do. Today, I want to speak directly to the families in our community about something that is deeply important, vaccinations, and in particular, protection against measles. At our facilities, we fully support vaccinations. We know that vaccines are a proven way to protect not just the individual child, but all the children around them, infants who are too young to be vaccinated, children with medical conditions, and our staff as well. Vaccines create a shield of protection that keep outbreaks from happening. I want to encourage all parents, please take advantage of the vaccines available to you. Protect your children, protect your neighbors, protect our community. Vaccination is an act of love. It's a gift you give not only to your own child, but to every other child they come in contact with. When we vaccinate, we stand together as a community that values life, health, and the future of our children. If you have any questions about vaccines, talk to your child's doctor. Ask questions, get answers, and make a decision to get vaccinated. We all want the same thing, a safe, healthy, and happy future for our children. Let's work together to make sure that future is possible. Thank you.
All right. Wow, on that note, on the heels of that powerful statement, we have gone through our current panel of speakers. We are open to a limited number of questions. So are there questions for our team?
If there is a measles outbreak coming, how fast do you think that will come?
You know, we don't have information about speeds and those things like that. We know, let me reframe. Are you saying how soon will it be before we have a case in Kansas City, or?
I guess if there is a case in Kansas City, how how quickly do you think that spread will be?
Oh, as you've heard today, it is very contagious. I think it is a matter of, there are a lot of factors that would go into that. Where are they? Are they in school? Are they around other people who are unvaccinated? So there are a number of cases, so I would hesitate to give a specific time frame of when that will occur. But as you heard today, one person can infect, or spread the illness to 9, 10, some studies say even higher. So we know that it would be very contagious.